Hi everyone, how's it going? Let's have another Q&A session on the AMC pathway as an international medical graduate based on the questions that you've asked. Let's get started. The first one is on the recency of practice requirement by AFRA. Now, recency of practice is equally important as your AMC examination and the English exam requirement to be eligible for registration under AFRA, which also means to be eligible to work as a doctor in Australia. It's the minimum of 4 weeks of full-time equivalent in one registration period or 12 weeks of full-time equivalent over 3 consecutive registration periods. Now, the full-time equivalent is 38 hours per week, and we cannot count more than 38 hours per week if you have, let's say, which is common in our home country, worked more than 50 hours, but we can only calculate 38 hours. As an evidence, you have to provide your registration and your work history in your CV. You can also ask your employer to provide a statement of service letter mentioning your full name, date of birth, your designation, your joining date, and whether you're currently working or your date of resignation, and whether you've worked full-time or part-time. If you have clinical gaps of at least more than 12 months, you may be asked to provide explanation of why you have the clinical gaps, provide evidence of the educational activities that you've done during the clinical gap, which can, one of the evidence can be the CPD activities. Now, it'll be good if you have a CPD home, which is essentially subscribing to a website to log all your educational activities. One of the cheap options that I found online is Osler's CPD. My personal advice, as is done by most of the IMGs, is that try to continue to work while you are studying for examination, while you're applying jobs. And if you have a big clinical gap, most of the IMGs go back to their home country, get registration, and do a doctor's job, meet the recency of practice requirement. And this is done when they get job ready, which means they have done the AMC exams, they have done the English exams, and now they need the recency of practice requirement. The second topic is internship position as an IMG. I would say it's very challenging and it's more difficult than getting a junior doctor's position because the usual expectation is we have completed internship and have something called intern completion certificate. Now, there may be some possibility based on case-by-case basis, but as I mentioned, the probability of getting the first job is higher if you're applying for a junior doctor's position. Now, it may be possible that if you have, let's say, just 1 year of clinical experience after internship and the hospital tells you that on the junior doctor's contract, you should work as an intern for a year first rather than going straight away to the junior doctor. And if this is the only job offer, I would take it. I would take it to get into the Australian healthcare system, and then you can start progressing in your career. The third commonly asked question is on observership. Now, to find an observership in Australia, you just have to check in Google, and I can find a list of hospitals and clinics that provide observerships, but they have their own opening dates, and you may have to contact them individually. Now, most of the time, observerships are super expensive. If you ask me if they are more important than AMC clinical examination, I would say no. Now, the advantages of the observership could be getting a knowledge of the Australian healthcare system, may be more useful, especially if you have difficulty clearing AMC clinical examination and you have AMC 1 and English examination on hand, and there could be more probability in getting job offers after you've done the observership. Based on the other IMGs, I've heard that some hospitals may provide job offers if you are very good on the floor while you're doing observership. And you may get references. But even with the references, the limitation is observership technically means that you're observing, you're not doing any clinical procedures, you're not doing any clinical assessments. Even if you do clinical assessment, you have to be supervised, or you have to discuss your assessments with your supervisor. So even for the references, to mark you on your procedural skills, your clinical assessment skills, it may be a bit tricky, but obviously it depends on case-by-case basis. So I would say observerships are optional. I would first focus on AMC clinical examination. If it's difficult, then look for alternative pathways like observership. The fourth commonly asked question is job offer after AMC 1 and English. I would say based on the current trend, it is not easy, but not impossible. I've personally seen IMGs getting job offers after AMC 1 and English examination. Now, the chances of job offer increases if you have a CV that addresses the selection criteria of that job, if you have more number of clinical experience, if you have more experience in acute care, if you have BLS and ALS, and if you have recency of practice. So long story short, keep applying and keep preparing for AMC clinical. I hope you find these information helpful. See you soon.